behalf of Dr. Jose Lar, Dr. Tim Lind, and all the staff here at Gonstead Physical Medicine, I'd like to welcome you to this webinar. My name is Dr. Scott Timko. The title for our webinar is Pain Management 101, and we are located here at the Gonstead Physical Medicine. I know a lot of you that are logged into it here tonight are patients of ours, and so we want to welcome you. Any of those out there who aren't patients, I also want to welcome you to the office, and you can see our website is listed here on this page, gonsteadphysicalmedicine.com. Love to have you go check out our website, take a look at it, lots of great information on there. Also, my personal email address is on there as well, drtimko@gonsteadphysicalmedicine.com. If you have any questions after the class that weren't answered, or you have any other questions regarding any other health concerns, feel free to shoot me an email and we'll get back to you. I always like to start off my seminars with a quote. This one at the bottom of the screen you'll see is a Buddhist proverb. It says, "Pain is inevitable, but suffering is optional." So I thought that was very apropos for our class here tonight. For those of you who don't know me personally, my name is Dr. Scott Timko. Let me just give you a little background information on myself. I'm originally from Western Pennsylvania, did my undergraduate studies at the University of Pittsburgh. I received my doctorate degree in chiropractic from Sherman College of Chiropractic in Spartanburg, South Carolina. Went on to start up a practice in Pennsylvania. I was there for a few years until moved out to Arizona here in 1999. I've been in practice for over 25 years. I've been here at Gonstead Physical Medicine over the past 10 years. In that time, I've taken hundreds of hours of continuing educations in the fields of chiropractic, physical rehabilitation, and in functional medicine. And so that's where my knowledge comes in, teaching a class like this one here this evening. So when we talk about a subject, we first of all need to get a little background on it. So to figure out how we're going to help you with pain, we need to understand pain a little bit better. Now, before I go any further, I see we have a few participants logged in already, and I'm sure a few more will be coming in, but I just wanted to remind you that those of you that are watching this live are going to be registered for a free gift. And so I want you to make sure that you stick around to the end of the class, and at the end, we're going to be telling you what that free gift is. Also, we are going to be having a special for any patients who are new to the office, or for those of you who haven't been in for a while and want to get reactivated. So stick around for that as well. So there's a few things I wanted to remind you of as we move along here. So as far as understanding pain, what is pain? Well, we know pain is defined as suffering or discomfort caused by an injury or an illness. There's two types of pain. Acute pain is the body's way of telling us there's something wrong in more of an immediate sense. It plays an important role in protecting us from harmful situations. Now, one of the most important things on this sentence is that pain is the way our body tells us there's something wrong. In fact, any symptom is just our body telling us there's something wrong. And the key to this is we need to determine what is going on, what is wrong, so then we can go along correcting that. And that's what we're going to be discussing here in the class today, how we can find out what is the true cause of our problems, and in this case, it's pain. Now, chronic pain is a little bit different. Chronic pain is long-lasting. Anything that's been going on 3 to 6 months or longer is considered chronic pain. It can be severely debilitating, and obviously, as with all pain, can reduce the quality of our life. Now, there's different types of pain, and we need to make sure that we're able to quantify and qualify these types of pain, especially when speaking with your doctor, so that you can let them know exactly what's going on. And it gives us a little better indicator of how we want to treat you depending on your symptoms, quality, and quantity. And so some common terms that we use to describe pain are aching, dull pain, shooting, sharp pain, burning, stabbing, tingling, throbbing. There's many more, but these are the real common ones. And these really give us a good indication, whether it's maybe just a deep, dull ache or whether it's sharp and shooting. These things are two different types of pain, and your doctor needs to know about these things so that we can best treat those. So make sure that you're using these terminologies when you're discussing your pain with your doctor. The most common causes of pain are just your typical muscle pain. And this can come from stress or tension or even overuse. And these are deep aches and pains. And obviously they can be related to nerve imbalances or problems within the spine or other joints or structures in the body. Other things that can create pain are minor injuries. Oftentimes we have falls, slips or accidents. Even automobile accidents are a common injury that we see here in the office. A term that a lot of you may be familiar with if you're chiropractic patients is subluxation. If you're not familiar with that, we'll be going over what a subluxation is here in a moment and discuss how that can create pain with you. Another type of issue that can create pain are metabolic imbalances. These are problems that are stemming from something internally going on with the body. Maybe you have a problem with one of the organs or tissues or cells within the body that's creating some sort of pain, either internally or referring it externally. So we're going to be covering some of these things with you during our class. Now, there's a direct correlation between the brain and pain. And of course, you may say, oh yeah, of course, your brain is what tells you that you have pain. But it's different when we're dealing with chronic pain versus acute pain. And in fact, pain research has discovered that brain activity changes in response to acute versus chronic pain. Acute pain is relatively sharp and severe and typically lasts less than 3 to 6 months and often related to soft tissue damage, whether that's muscles, ligaments, and tendons, or others as well. When we're dealing with chronic pain, this is pain that lasts beyond 6 months. In this case, the nerve signals continue to fire, telling you that you still have pain, although you may not see the original injury that occurred. Maybe the bruising has gone away, the swelling has gone away, but you're still dealing with pain. And oftentimes these people are frustrated because externally they may look fine, but internally they're still dealing with this pain. One of the most severe issues we see with this is something called fibromyalgia, where people are dealing with this chronic pain. Again, they look fine on the outside, but they have a lot of pain on the inside. And so we're going to talk to you again today about how to deal with both types of pain, whether it be acute or chronic pain. So again, with either type of pain, whether it's chronic or acute pain, we know that it can be debilitating, and it often causes interruption with daily activity, or what we call activities of daily living, or ADLs. Thankfully, there are natural solutions available for those who are not comfortable with medications or surgery. And hopefully none of you are comfortable with this. Now, obviously, sometimes medications are necessary, sometimes surgeries are necessary, but we should be doing everything in our power to not use medications and to not have surgeries until it's our last resort. So today we're going to talk about natural solutions for pain management. I'm going to highlight those here, and then we're going to go through each of them in a little bit more detail for you. The first one is structural correction. If there's an imbalance within a structure, including a joint, then we need to correct that structure. And of course, we can utilize chiropractic care for these types of things. Then we want to incorporate some sort of therapy, or we may need to incorporate some sort of therapy. Initially, a passive therapy may be recommended. A passive therapy is something where the patient is not involved with directly. They may be lying down on a table and there may be an electrical muscle stim device hooked up to them. They may be getting laser or even massage therapy. Once the pain has begun to diminish to some degree, then we want to move on to more active type therapies. These are gentle stretches, strengthening, even some tractioning protocols designed to stabilize the body. We may also incorporate spinal decompression in your treatment if that is indicated when we're looking at your x-rays and symptomology. Functional medicine takes the next precedent when things aren't responding the way that we think they should be. If you're still continuing to deal with those chronic pain issues, again, maybe the chronic fatigue, the fibromyalgia, rheumatoid arthritis, these types of things that are responding to some degree to the treatments we do, but maybe just aren't taking it to the next level, we may need to look into functional medicine, which again treats the underlying cause, much like chiropractic, but here we're looking at it from a neurometabolic standpoint. And finally, self-management. We're going to be teaching you tools that you can utilize at home or in your workplace to help you manage these pains for you. So let's go ahead and get started. First off, talking a little bit about chiropractic care. Now, I know a lot of you are patients that are watching this, and so you probably know a lot about it, but here's a refresher course for you. And for those of you who aren't, this will help you understand a little bit more about what chiropractic is. Before we talk about chiropractic, though, we've got to talk a little bit about anatomy. So we know that the spine is made up of several small bones called vertebrae. As you see in the cutaway section appearing here, those bones are stacked on top of one another, separated by discs. Think of the disc as a shock absorber between the vertebrae. The vertebrae are held together by ligaments, and then muscles attached to each of those vertebrae, and the muscles are attached by tendons. So the ligaments hold the bones in place, and the muscles and tendons help those vertebrae move in the proper positions as we go through our ranges of motion. And the discs, again, are the cushioning between the vertebrae. Those discs are made up of a hard cartilage outer portion and a soft gelatinous center, but all joints in the body, especially our synovial joints, have some sort of cartilage between those. So a lot of the stuff that we're talking about with the spine can relate directly to other joints in the body, including your shoulder, your elbow, your wrist. A lot of people don't realize that about chiropractors. We don't just adjust the spine. Well, some chiropractors may, but in our office here, we do a lot of extremity work. So don't forget to tell us if you have any other types of problems. Again, like I said, shoulders, elbows, wrists, knees, hips, even your feet, or even your TMJ. These can all be worked on structurally. A little bit more about spinal anatomy. We know that the nerves branch out from between each of those vertebrae, as you see representing in this picture here. Those nerves continue to branch out, getting smaller, smaller, and smaller, eventually reaching every single organ, tissue, cell, and system of the entire body. It's pretty amazing, isn't it? This chart shows you where the nerves exit the spine and what organs can potentially be affected by compressions or misalignments within the vertebrae, putting pressure on that nerve. And so we know, for example, the neck and the upper back, those nerves go to maybe the thyroid gland or the heart or the lungs. We know that the mid-back could go to the stomach, to the blood vessels of the abdomen. They could go to the pancreas, the adrenal glands, or the intestines. And we know that the lower back could potentially go to the bladder, the reproductive organs, or the kidneys. And I see someone raised a hand there, and I will mention at the end of the class, we're going to answer all the questions that you have. But if you do have a question at this point, go ahead and hit the question button at the bottom, and I'd be more than happy to go ahead and answer the questions as we move along. But like I said, if you could hold those questions to the end, unless there's something that's the kind of an emergency and you need to know right away, go ahead, hit that question and answer tab at the bottom, type in your question, and I will get to those for you. Okay, this next slide, we're showing the vertebrae, and we're seeing that the nerves are exiting between each of those vertebrae. And it says we're going to teach you a new word. Those familiar with chiropractic will recognize this word. Those of you who aren't, this word is subluxation. So what is a subluxation? A subluxation is a misalignment of a vertebrae. And we see this vertebrae misaligned here, putting pressure on the nerve or compressing that nerve. This, of course, is going to alter the messages that are going from the brain to the body or from the body to the brain. Of course, this can create pain, but it may not create pain. It doesn't always create pain. In fact, only 9–10% of the nerve fibers carry pain impulses. The rest are messengers from the body to the brain and the brain to the body. So you can have these subluxations. Maybe you don't even recognize it. Maybe you're just stiff or sore, but these subluxations may be choking the life from you by altering those impulses going to the body. So what does chiropractic do for these subluxations? Well, chiropractic care aims to relieve the pain and improve function in the body and increase mobility by removing these areas of subluxation. Of course, if you're a chiropractic patient, you know how we do this. The procedure of a chiropractic adjustment involves an application of a controlled sudden force to the joint with the goal of correcting the alignment. And we call this a chiropractic manipulation or chiropractic adjustment. When we have a chronic problem, when we have poor posture, abnormal spinal curvatures, or injuries, including disc problems, additional therapeutic treatments may be necessary along with your chiropractic care. So what are some of these additional therapies? Well, we call these physical medicine modalities. We talked earlier about the passive and active therapies. Here we're going to discuss the passive therapies. These passive therapies are therapies such as electrical muscle stimulation, cold laser. These are all used to reduce inflammation, to decrease muscle spasms, and help to ease the pain up. And so they assist essentially with our adjustments in helping you feel better. Another type of passive therapy that's utilized is massage therapy. Massage therapy may be used to improve circulation to an area. Again, also going to help reduce swelling and inflammation. And all these therapies will encourage quicker healing with the body. Now, there's a special type of passive therapy that we utilize here in the office as well, which is treatment for neuropathy. If you're not familiar with neuropathy, neuropathy results from damage to your nerves. It often causes weakness, numbness, pain, even pinpricking sensations, difficulty with your gait due to loss of feeling within the feet. It usually occurs in the hands or the feet. And we have some specialized treatments for these neuropathies. So if you or anyone else you know is experiencing what's commonly called peripheral neuropathies, make sure you mention this to your doctor as well. A specialized program will be utilized to help you with this, including leg wraps, Tesla Max muscle stimulation, which is a specialized electrical muscle stimulation, cold laser therapy, vibration therapy, and of course we incorporate adjustments in this when necessary as well to increase that nerve response to those regions. Special consideration is obviously placed on diet and supplementation. Again, a lot of these neuropathies are caused by blood sugar imbalances, so we want to take care of that issue as well when we're working with your neuropathy. Once we've got you feeling better, once the inflammation has subsided, once your pain level has decreased to some degree, we want to move you on into active therapies. Active therapies are specialized stretches, strengthening protocols, and even traction protocols designed with your specific needs and abilities in mind. So the doctor is going to talk to the therapist about what your particular issues are, what muscles may be tight, what muscles need strengthening, what areas of your spine maybe need to be moved into a more corrective position. And we're going to set up a specific program with you to help you utilizing these active therapies. So our highly trained therapists work closely with the doctor to make sure you receive the greatest benefits from these therapies. And of course, we don't want you to leave here and not be able to continue getting better. So we're going to be teaching you how to continue these therapies when you leave our office, when you're at home, when you're in your work environment, so that we're able to hold your adjustments in place. In fact, think of active rehabilitation as the cement that holds your adjustment into place. The next pain management solution we want to look at is non-surgical spinal decompression. Here at our office, we have what's called the DRX 9000 true non-surgical spinal decompression. What this does is it decompresses the intervertebral discs. This helps to achieve pain relief that's associated with what we call herniated discs or protruding discs, bulging disc, degenerative disc disease, and a big term called posterior facet syndrome. And so all of these things can be creating pressure on the nerves and creating acute and or chronic pain symptoms. Oftentimes we'll find that these also are associated with what we call radicular pain, which is pain that's radiating out. It may go from the neck into the arm or into the hand, or it could go from the low back into the legs. We often call that sciatica. And so spinal decompression is used in these types of cases to help provide relief. And I'm going to show you what this spinal degeneration looks like on x-ray. So this is an example of a neck from the side view. You can see the person looking to the right here as I'm looking at it, and the back of their skull. You can see the curve of the neck goes forward. The most important thing is looking in between each of those vertebrae. You'll see nice spaces where the discs are located. If you're not exactly sure what you're looking at, this next picture, you'll know what it looks like to not have those spaces. And so in this picture, the neck has straightened out considerably. The spaces between the vertebrae are degenerated. We call this degenerative disc disease or degenerative joint disease. And so with this, it can be compressing that disc. And these are the types of issues that the spinal decompression can help with. And we see this through all areas. I'm showing the neck here, but this occurs throughout the mid-back and the low back as well. So how does the spinal decompression work? What is the theory behind it? Well, we know that when you're put on that spinal decompression table, that DRX 9000, the muscles are able to relax, and then we begin to decompress the body. So decompressive forces spread apart the vertebrae of the spine, as you're seeing in this picture here. This then relieves pressure off of the nerves and takes pressure off of the intervertebral discs, which is very important as well. Once this pressure begins to relieve, then we can begin to draw in that herniated disc. Also, healing fluids go into the disc. You see, the discs don't have veins or arteries going directly to them, and they get their nutrients from the surrounding fluids. And so when they're compressed, they're not getting the fluid. When they're separated, that fluid can go in there and can begin a healing of the disc, and it can even reduce the size of herniations. And so we have excellent luck with people told that they may have had to have some sort of surgery to remove that disc, but we do the spinal decompression and they no longer have to have the surgery. So it's a pretty amazing process for those of you who qualify for this. So if you're having these types of problems, make sure you talk to your doctor about spinal decompression. Next pain management solution we want to talk about is functional medicine. Again, what is functional medicine? What is this term? Well, functional medicine are treatments that focus on the optimal functioning of the body and its organs. And I'd like to see chiropractic is part of this, and we certainly focus on the optimal functioning of the spine. But sometimes there's other organs or systems that are involved that may affect the body and not allow you to heal completely. So in other words, functional medicine addresses the underlying cause or causes of disease. We use a systems-oriented approach of engaging both the patient and practitioner in a therapeutic partnership. Now, this is different than your typical allopathic or medical doctor who you go to, and if you start to ask too many questions or you question his prescription or surgical recommendation, he'll say, well, if you don't believe what I'm saying, then go get another doctor. Well, we don't say that here. We want to work closely with you, and that's how we're better able to determine what's going on and to get to the root cause of your problem. So instead of treating the symptoms directly, true healing comes from finding the root cause of the problem, which are alterations in healthy structure. And then we correct these. Now, we're not overlooking the symptoms. We know they're important, and we want to do that. But we don't want you to just be chasing your symptoms and never getting rid of the cause of the problem. And we don't want you to be like that cute little dog you see in the picture here, who continues to chase his tail but never catches it. We don't want you to chase your symptoms and not find them. We want to get to the root cause of the problem, correct that underlying cause, and then the symptoms will diminish or go away. So how do we find the cause? Well, we need to put on our Sherlock Holmes hat, and we need to get down and find out what's going on. We need to investigate, and that investigative procedure will take us down multiple paths depending on what we're finding. This includes, obviously, a thorough consultation, case history, and examination. This may be above and beyond what we did chiropractically. We may need to sit down and do a nutritional consultation with you to find out what's going on underlying with you. We may need to do in-depth diagnostic testing. This may start off with something as simple as blood work, but we may need to go further with this type of testing to find out exactly what's going on with your pain. So let's talk about some of the causes of chronic pain. We touched on one of them already, physical trauma. These subluxations oftentimes caused by trauma to the body, and whether that's chronic stress in the body or whether it is some sort of physical injury or accident. And so again, chiropractic is great at taking care of these problems, but if we're working with you and things aren't responding quite the way we expect them or we hope to, we may need to move on a little further. We may need to look at the cause of your chronic stress. There are organs in your body that deal specifically with stress. One of them is called the adrenal glands. The adrenal glands produce cortisol, which medical people have synthesized into cortisone, and they then inject that into the body to reduce inflammation. So working with the adrenal glands can reduce inflammation in the body. Your thyroid gland also has a function with energy production and stress. Blood sugar as well is a big part of this. And so we need to look at these things, and we may need to do further testing on those areas to check for hormones of the adrenal, thyroid gland, even the pancreas, to find out what's going on. Some other causes of chronic pain could be nutritional disturbances. Obviously, we want to talk to you about getting the right nutrients into the body, eating properly. And, it's been said, you are what you eat, but I take that one step further. I say it's not just you are what you eat, but you are what you eat, what you digest, what you absorb, and what you utilize. And so disturbances within the gastrointestinal system can have a great effect on your body's ability to heal. So we may need to look at that. Do you have leaky gut? Do you have irritable bowel syndrome? Do you have chronic constipation? Do you have issues that aren't allowing you to absorb the nutrients and utilize those nutrients? Or maybe you're just not getting those nutrients into your body that you need. Environmental toxins is another cause. These could be things that are on your food or in your water, pesticides, herbicides. They could also be heavy metals such as mercury, aluminum, cadmium. These things can all affect your body and can create problems that are leading to pain for you, along with other problems as well. Food allergies and sensitivities are a real common one. We see this a lot with migraine headaches. A lot of patients come to chiropractors for headaches, and we do an excellent job in treating headaches. In fact, probably 80% of our patients that we see or more that have headaches get it resolved through chiropractic care alone. But there's a few that these migraines begin to hang on, and we need to look further. Oftentimes food allergies or food sensitivities or even hormonal imbalances are what's maybe causing it. So again, testing is important to find out what's going on there. Chronic infections are another interesting one that is oftentimes overlooked through the medical community. A chronic staph or strep infection, or an infection within the gastrointestinal tract. We call that SIBO, small intestinal bacterial overgrowth. Even parasitic infections, all of these things can create imbalances within your body that can lead to chronic pain cycles. And lastly, hormonal changes. I mentioned that above, the one to touch base with not just the thyroid or not just the adrenals, but also your sex hormones, progesterone, estrogen, testosterone. These again can have profound changes on your bodies and begin to help restore you to optimal health once we balance these things out. So if you go to your medical doctor and you tell them that you have pain, what are they going to say? Well, oftentimes they just say, just live with it. You know, you're old, what do you expect? You know, I don't believe that. I believe we should live long, healthy lives without pain. If they don't say that, they may give you some kind of medication, maybe a non-steroidal anti-inflammatory, or maybe you're taking these over the counter using ibuprofen, Advil, maybe you're using Tylenol, which is acetaminophen, maybe you're getting prescriptions for naproxen or COX-2 inhibitors, which are other anti-inflammatories such as Vioxx or Celebrex. Maybe you're being given pain medications, Tramadol or Vicodin or others. You may be given muscle relaxants such as Soma or Flexeril. The problem with this is a medication is not a medication without a side effect. If it doesn't have a side effect, it's considered a food. And so all of these medications have side effects. In fact, kidney disease is the 7th leading cause of death in the United States. You know what the leading cause of kidney disease is? Over-the-counter prescription medications, including ibuprofen, acetaminophen, and aspirin. And so these things all have side effects. It's been said within the last year, 2.2 million people had drug interactions from prescription medications that created hospitalization, and over 106,000 deaths occurred because of this. This number is grossly reduced. It hasn't been, it's been said that over 10 times this amount is what really is occurring. So over 22 million people and over 1 million deaths have occurred because of this. So we need to find alternatives to these things to help you. Again, we want to get to the cause of the problem, but sometimes if the symptoms are severe enough, we need to address those. So we want to talk about some prescription alternatives to help you with your pain. One of our favorite products at the office that we use here is called Inflammatome. This is a natural anti-inflammatory that has a combination of herbs, nutrients, proteolytic enzymes, all help to modulate the inflammatory response and reduce pain and inflammation within the body. It's an amazing product. Think of this as your substitute for Advil or ibuprofen or acetaminophen. It's a wonderful product to reduce inflammation and pain in the body. The next product we like to use is called muscle cramp and tension formula. This is for muscle spasms and as it says, muscle cramps or tension in the body. It contains electrolytes such as calcium, magnesium, potassium, and other herbs like chamomile that are all designed to help relax the body, calm the body, and ease muscle cramps and ease tension. Another product that I'm a big fan of is Disc Flex. Now this says Disc Flex and it says it's an advanced intervertebral disc formula, but it can be used for any joint. Remember, all these joints in the body have cartilage and this helps to rebuild cartilage. In fact, it has hydrolyzed collagen in it, which is a really highly absorbable form of amino acids that help rebuild the discs and the joints. It also has glucosamine, which a lot of you have heard of, that helps to rebuild cartilage. Devil's Claw and turmeric are natural anti-inflammatories, and grapeseed extract, which is a great antioxidant. It's a wonderful product. Topically, we recommend BioFreeze. This is a topical analgesic to help with pain. So those of you who have used it know it goes on kind of cool, hence the name BioFreeze. After a while, it warms up a little bit. It doesn't get real burny hot like some of the other topicals. Some people like that really hot stuff, but we like using this because it doesn't get too hot, but it's really very effective. It has some herbs and other natural anti-inflammatories like menthol in it that helps to reduce pain. So if you stuck around this long in our class, I told you at the beginning, you'd be getting a free gift from us, and we're not done yet, so don't go away. But I wanted to let you know that because you've joined in, and I see we have several participants here, come into the office, and what we're going to do is give you a free muscle cramp and tension formula or a free BioFreeze, one or the other, whichever one that you choose. That's your free gift for coming in and coming to our live webinar here tonight. So thank you for coming. Again, we're not done yet, but I wanted to let you know that that's our gift to you. Okay, let's talk about some self-management techniques now. Of course, as we're getting you healthy here and your body's getting better and better and better, and you're having less treatments at our office, we want to make sure that you're still taking care of yourself at home. And there's a number of techniques that have been identified as helpful tools to deal with chronic pain and even the acute pain stages. So we'll go through these relatively quickly. Again, each of these topics, I could spend a whole 45 minutes or an hour discussing. We don't have the time, but Obviously, if you have any questions, feel free to talk to your doctor specifically or use my email address and shoot me out an email. We'll be happy to get you the answers that you need. So what are some of these self-management techniques? Well, we want to pace ourselves and not go too quickly. We want to make sure we're getting quality sleep. And if you're having issues with that, that's a big problem. Talk to your doctor about that. We may be needing to do some testing to help find out what's going on there. Making proper food choices is like you see in the picture up there, green leafy vegetables, maybe doing a green drink. We have a product here called Greens First, which is absolutely amazing. It gives you the nutrient value of 12 to 15 servings of fruits and vegetables. I use it every morning myself to get my day started. It's a fabulous product. We want to make sure we're getting good physical activity, and that's why we're going to teach you the exercises here that you can utilize at home to continue to keep your posture upright, to keep your head over your shoulders, to keep your shoulders over your hips over the knees, and in a proper posture. Also, when you're sitting at your desk, you want to look at ergonomics. We want to make sure that you're sitting properly there as well. We want to make sure that you have a proper focus as to the techniques that we're telling you, and we want to make sure you're able to ease your tension up through meditation techniques, through prayer as well, and self-affirmations. These things are all important in just helping relax and calm the body down. Positive thoughts are important in this as well. And again, with meditation, we can do this. So these are several self-management techniques. Again, we could take any of those topics and do a whole seminar on that. And in fact, we're going to be doing these webinars monthly here. And we're going to be talking about a lot of these different topics a lot more in depth. So I kind of touched on several things tonight. If you want to learn more about these things, stay tuned for the upcoming emails that are going to talk about our upcoming webinars and the different topics that we're going to be covering. So for best results, make sure that you talk with your doctor. And again, we're here to answer any question you have. So no question, don't think the question's too stupid. There's no such thing as a stupid question. Feel free to answer, talk to your doctor or our staff members. They're all here to help you. So in conclusion, love the science. As you are leaving pain, enjoy the journey. So in conclusion, what have we learned here tonight? Well, we learned that sometimes managing pain is as simple as removing nerve interference through chiropractic adjustments or manipulations. And sometimes that's all that's necessary. Oftentimes we need to take it one step further. We need to use those physical medicine modalities that we talked about, the passive therapies and the active therapies, which are all necessary to assist in the healing process. Sometimes we need to take this one step further. For more difficult or chronic conditions, we may need to look at those metabolic imbalances, and we may need to address those using functional medicine to find and correct the true cause of your pain. And again, one of the first things we do is some simple blood work, and we offer those here at our office. We have scripts that you can take to a local lab, get the blood test done. We'll look it over and make recommendations for you. We do a great, we have an arrangement with a lab that we have some great rates on. So if your insurance isn't covering for these things, or maybe you don't have insurance, talk to your doctor about it. We have some awesome cash rates for these labs, and we'd be happy to get you those and get some lab work done on you, and maybe get an idea of what's going on that we can help you a little further with. And lastly, you and your doctor can work together, and our staff, of course, our therapists, all work with you to develop a self-management plan to allow you to have more control over the pain in your life, hopefully get rid of the pain altogether and live as long, healthy life as possible. So I said, if you were new to chiropractic, or maybe you haven't been in for a while and you wanted to get back into chiropractic, we have a special webinar offer here for you tonight as well. And so any new patient or reactivated patient will receive a consultation, examination, x-rays of one region of the spine, and a report of findings where we go over all this and make recommendations for you for only $85. This is over a $200 value, so it's a great, great deal. And this offer is good through the end of the month. And so we'd love to see if you haven't been in for a while, or if you know friends, family members, coworkers that need to get in, tell them about this offer. This isn't just for those who are on the webinar tonight, but we will offer this to any of your friends, family, coworkers as well. So at this point, I'm going to open it